People with disabilities at times encounter barriers when trying to access medical care. Common obstacles are physical barriers, communication barriers, attitudinal barriers, and social policy barriers.
Just getting on an exam table for a public exam is very difficult. It takes a lot of time and a lot of energy for me. So there's some things that I admit that I put off or, just kind of avoid.
Ramps, elevators, adjustable exam tables, and other equipment enable access to medical care, as well as to optometry, dental care, and a full range of health services.
To my speech impairment, they don't always realize that I am able to speak for myself. So if I happen to have someone with me for some reason, they tend to talk to that person rather than to me.
So there's an easy tendency for people to say, oh, you're deaf and I don't need to communicate with you. Sort of a mentality from the old days that exists even still today, that some hearing people think that deaf people are mutes and even dumb. But we have to remove that stigma.
There are often generalizations that if you can't see, then you also can't make a decision, or even sometimes you can't talk. I've actually had people raise their voice when they were communicating with me. It's like, I can hear okay, I just can't see.
One of the greatest barriers is still the social kind of misconceptions about me and my lifestyle. Me and my health, really, I think. They don't realize I have a very active, full life, or they have a lot of other interests, and my health isn't my main preoccupation.
Doctors think that I am mentally retarded and speak to me as if I am mentally retarded. And I usually have to tell them that I have a master's degree.
Social policy barriers exclude people with disabilities in terms of economic access to health care insurance.
The main insurance I have is Medicaid, which is in California. It's Medi-Cal. And unfortunately, many doctors do not take Medi-Cal. And there are many procedures and many prescriptions that are not covered by Medi-Cal. A lot of durable medical equipment that I need is not covered by Medi-Cal.
Probably one of the most difficult problems that we have is that in many of the circumstances where we find an overuse of emergency services, which are actually much more expensive than primary care services, you find people who are what we call underinsured.
Many providers do not accept patients with Medicaid because reimbursement rates may be low and payment delayed. This can make it more difficult for people with disabilities to find primary care physicians and specialists and to obtain the treatment, equipment, and medication they need.
It puts the physicians in the position of having to say no, and when the patients feel that they really need care, they go to the emergency room because they know that once they walk through the door, they will be treated.